Hi. I just thought of explaining one or two points where we, even after years of practice, we dentists, we tend to commit some mistakes. So first would be not taking a pre-op IOPA. This mistake I have committed in the past, and what happens is when the patient comes to us, we rush towards the particular treatment protocol, right? We start with the treatment without explaining, without taking a proper pre-op x-ray, and without looking at the adjacent teeth. Now what happens is sometimes, we see a cavity, we start with the root canal treatment, but we forget that there can be a deep class 2 cavity in the adjacent tooth also, right? So I would always recommend you to take a good pre-op IOPA. A pre-op IOPA and a master cone x-ray is a must in my practice. I cannot miss these two x-rays. That would be the first mistake that we committed. The second mistake is, over promising and under delivering. So what I mean by that is, whenever you see a repeat root canal case, a repeat re-RCT case or a repeat root canal case, do not just rush towards starting the treatment. You should always mention the success rate on a piece of paper in front of the patient, right? Always write down that the success rate is around 97%, and in case of a failure, you would need a implant or some sort of treatment or replacement, right? Do not rush towards starting a treatment, by promising that yes, we can treat this tooth, the treatment success is 100%. Start with under promising and over delivering, right? And the third thing that is related to practice management I've learned is, sometimes what happens is whatever we earn in our practice, we sort of deploy that cash or that money that we earn directly into our practice back, right? So instead of putting back money directly into your practice, the whole lot of money that you earn per month even, I would recommend you to keep some cash or some money saved in your bank account, or let that money be invested in a proper place. First of all, because what happens is, in private practice we do not understand that even we should be paid, right? We deserve a salary. So pay yourself first. Take out some money from your earnings of that month, invest that properly, invest that into stocks or your any mutual funds or your FD, even whatever place you want, but pay yourself first. Then you should think of reinvesting into your practice. In my early years, I think around 5 to 7 years, I did not even think of saving any penny, right? I used to save maybe a few thousands, but that doesn't help. Now what I do is, whenever I get some huge chunk of money because of an implant patient or something, the first thing I do is invest that into my investments, and then you go ahead and think of the expenses of the clinic. So that would help. So let me know in the comment section if it helps. Cheers.